Perform hand hygiene before entering the patient's room. Introduce yourself to the patient. Hi, it's Crystal, your nurse. And identify the patient using 2 identifiers. So to start, Joanne, I'm here to take a wound swab today. The physician's a little concerned that you may have developed a deep tissue infection. For patients with wound pain, consider administering analgesics 30 minutes before changing the dressing. Perform hand hygiene. If splashback is anticipated, apply appropriate personal protective equipment like goggles and a gown. So we're going to take a swab today and send it away to see if it's growing anything. I'm just going to remove your dressing and clean your wound. So to start, we're going to cleanse your wound. The purpose behind irrigating a wound is to stimulate the granulation tissue to form and to remove any non-viable tissue or bacteria from the surface of the wound. So I'm going to take a swab of your wound. It shouldn't be painful, but I do need to apply pressure at your wound bed. Teach the patient signs and symptoms of wound infection and when to seek help. Teach the patient about their dressing procedure. Okay, so I'm going to apply your secondary dressing. When you go home, we will be teaching you or a family member or friend how to change your dressing. When it comes to wound packing, the important thing is getting that packing into the base of the wound and then inserting the remaining material, fluffy like a cloud is what we like to say. Okay, I think that's everything we need. We'll send this swab off to the lab. If you need anything, please use your call bell. I'll be in the next room. Label each specimen tube and verify information in front of the patient. Make a notation on the label if the patient is receiving antibiotics. Document if you administered any pre-procedure analgesia. Your wound assessment, the time the specimen was obtained and the type and source of the specimen, the application of any dressings, the patient's response to the procedure, and any patient teaching that was provided.